Good morning, everybody. Thank you so much for joining us today. Today's session or today's hangout is going to be about funding. NMAC has invited 3 guests to come and talk to our movement about how to survive during this COVID-19. Obviously, like many of you, we're very concerned about what's going to be happening to the HIV infrastructure in America, and that there are a lot of concerns about what will happen when we all go back to work. And so what's going to happen today is that we've invited 3 people to speak with you. The first is going to be John Barnes. John is the executive director of the Funders Concerned About AIDS. And he will be doing a short PowerPoint presentation to walk you through a discussion about kind of some recent findings that Funders Concerned About AIDS had on HIV funding, as well as to talk a little bit about their COVID resource page on their website. We then invited 2 funders who have stepped up. 2 funders, 2 weeks ago, I sent out a request to donors that this was the time that we needed them to stand with the HIV community. And so today you're going to have Colin Lindsay and Darwin Thompson talk about what the Elton John AIDS Foundation and what Gilead are doing to help our movement stay afloat and survive through these difficult times. I want to provide a short disclaimer before we go into the session as part of NMAC's effort for transparency. What I want you all to know is that NMAC is a grantee of the Elton John AIDS Foundation and of Gilead, and we are very grateful for their support. However, we should note that their support does not influence the policy positions that NMAC makes. I should also note that NMAC will be applying for the Gilead COVID-19 emergency response. We are not applying for the Elton John one because we are not eligible. But in full disclosure, we hope that this will help through all those transparency issues that we've been talking about. We'd like to do a short tutorial right now. If you go to your box on the far right-hand side, you will see it says go to webinar. And in that section, there is a place called questions. What I'd like you to do in the question section right now, if you don't mind, is to get used to using it, is if you could put your name, your city, and the agency that you're with. And Chip, if we could start reading out, who are some of the folks that have joined us on today's call? So please put your name, your agency, and the city you're from. Chip, who's joined us?
All right, so we have Joyce Brooks from Rain in Charlotte, North Carolina. Chris Baker from Brighton in Frontline AIDS. Daniel D. Driffin, Atlanta, Georgia, The Spot at the Rush Center. Claudia from Lake Worth, Florida, Compass Community Center. Rock Schuler in DC with AIDS United. Dylan Brooks from Lakewood, Florida, Compass Community Center. Julia Ock, AIDS Free Pittsburgh, Allegheny County, Pennsylvania. Crystal Martell with the Well Project in Brooklyn. Kim from the National Network to End Domestic Violence in Washington, and a lot of others.
Great. Well, welcome, everybody. Thank you so much for joining us. That will be the box that you will be asking your question. When you ask a question, could you also put your name to it so that we could identify who's asking the question? What will happen after this is that you're going to get an evaluation form at the end of this and one tomorrow. We would really like you to fill out the evaluation forms. This is a new learning format for NMAC, and so we need feedback. So please feel free to be as honest as you want to be or can be about how this format does or doesn't work for you. Because unfortunately or fortunately for NMAC, this is a brand new tool that we are using, and we are learning as we go through this. A copy of the slide presentations and a copy of the video presentation today will be on NMAC's webpage at our COVID-19 resource page. So all you have to do is go to www.nmac.org and you will get it. As we go through the presentations, I will ask Chip to put up the email address for each of the presenters so that you can also contact them directly after their presentations. So that's it for the introduction, everybody. I'm going to be turning it over now to John Barnes. John is with Funders Concerned About AIDS, and he will be walking us through a short PowerPoint presentation to talk to us about resources that we can look for. Thank you, John, for joining us today.
Sure. Thank you for having me. Let me just get back to, let's see. Can you see my screen?
Mm-hmm.
I'm screwing up my presentation. Can everyone see my screen?
Yes, we can see your screen.
Yeah.
Oh, great. Okay, sorry, I thought I lost you. Sorry about that. So unfortunately, I'm going to have to leave this way so that I can see my notes. It didn't occur to me sooner. First, I thought I'd start out by letting folks know who FCAA is. Funders Concerned About AIDS is a membership association. Our members are corporate and foundation HIV funders from around the world. And what we do is to monitor HIV philanthropy, to help funders find the gaps in funding, to help them find opportunities to work with one another, to build coalitions such as our Southern HIV Impact Fund. And we also work within broader philanthropy, to especially at the critical intersections of HIV and other important social issues like LGBT rights, human rights, reproductive justice, aging, immigration, to try and make sure that funders who don't identify as HIV funders understand how their funding intersects with HIV. So this slide shows some of what we've been doing in response to COVID-19. More resources and links to other groups are on our website, which you see at the bottom of the slide. And NMAC, I believe, will share the slide so you don't have to worry about getting everything down. Let's see. So we're hearing from funders about how they're responding to COVID-19. And what we're hearing is that they're sustaining support for populations most affected by HIV and AIDS, who are also most affected by COVID. Providing new emergency funds to respond to the epidemic, creating responsive grant-making practices, increasing investments in policy and advocacy, and innovating in networking organizing capacity. That's what we're hearing from funders about what they're doing, but we're curious to hear from you about your experience with funders and what you're experiencing them doing. I've chosen a few examples here. Health Foundation of Greater Indianapolis gave grantees new funding to support their capacity. Third Wave Fund is continuing to support vulnerable communities impacted by HIV, racism, and homelessness, particularly trans communities. MAC is increasing support for grantees to be able to provide essential services such as food. AMFAR is expanding research, and you're going to be hearing from Elton John and Gilead, so I'll let them talk more about what they're doing. But I also wanted to point out some other resources, some of the organizations that I mentioned that we work with in broader philanthropy, such as Asian Americans, Pacific Islanders in philanthropy, grant makers concerned with immigrants and refugees, funders for LGBTQ issues. All of these organizations are also doing things in response to COVID. And I encourage you to think beyond the HIV silo when you think about funding opportunities, because the populations you're serving are of interest to other funders. They're often LGBT communities, they're often immigrants, and even broader health funders are interested in what you're doing. A lot of community foundations have set up funds in their own communities, so be sure to check those out. And data is really important and critical. And I just wanted to highlight that AMFAR has updated their Ending the HIV Epidemic database. Candid, which used to be Foundation Center, has updated information on what funders are supporting related to COVID, and FCAA, obviously. Paul mentioned our resource tracking report. Each year we release a resource tracking report that reports what global philanthropy is doing for HIV and AIDS. It has a section, of course, on the US epidemic. We've seen a disturbing trend over the last 5 or 6 years, especially of big funders who have been funding for years and years leaving HIV funding, and more of the funding being concentrated at the top. You see some of the top funders here: Gilead, Elton John, Mac, ViiV Healthcare. AIDS Funds is in the Netherlands. That makes HIV funding more vulnerable. It also reinforces my message about the importance of going outside the HIV silo when you think about funding opportunities. I'm going to stop there and see if I can figure out how to stop sharing my screen. Thanks.
Great, thank you, John. And now I'd like to have Kali click on to talk a little bit about what the Elton John AIDS Foundation is doing. Thank you.
Great, thank you, Mac and Paul, for inviting us to be part of this conversation today, and good morning to everybody that's on the call, as well as good morning to my fellow presenters. I'm pleased to join you guys today from the city of New York, also the epicenter of the COVID outbreak. And please know that the Elton John AIDS Foundation is standing with you here in the United States, as well as with the global community, as we make our way through these troubling times in our fight against COVID-19. We sent an email out immediately to our partners as soon as we heard about the outbreak, and started hearing directly from many of our partners how deeply the COVID-19 outbreak is impacting our work, your work, the work we do together with communities living with and affected by HIV. We understand that many organizations went to work immediately, possibly even without having the essential personal protection equipment that is so desperately needed and difficult to find in many places like New York. But you went to work immediately, adapting to continue to do your work both carefully with as much equipment as you have, but also mobily and virtually where you could. And in light of this outbreak, we became concerned that in this reality, we could lose significant gains that have been made in our fight to end the AIDS epidemic. And we wanted to find a way to support your timely and heroic actions to maintain the course of action in the fight against HIV. As a result, EGF launched the COVID-19 Emergency Support Fund to help our partners that have been EGF grantees for the last 3 years do their work on the front lines as safely as possible during this unprecedented period. Even before the joint statement from the leaders of philanthropy serving organizations released a statement calling on funders to increase grant spending during the COVID-19 crisis, we had already decided that in order to avoid losing ground, they were going to need to go above our existing commitment in 2020 to find some new money to put out to support emergency responses to COVID-19. We strongly felt that it was important that the fund accept applications from existing EGF grantees that have strong potential to address specific challenges that have arisen from the outbreak. Unfortunately, we wanted to open up to the full universe, but there's so much need and so much demand out there. We knew that if we didn't have somewhat of a limited universe, it would result in too many applications for us to be able to respond in a timely fashion. We do hope to be able to put out additional rounds of the emergency support fund and respond to additional need where possible. In addition to the emergency support fund, we also are offering flexibility to all of our current grantees. So in many ways, we're hoping that the emergency support fund will be used by individuals who are without existing support from EGF. That way we can leverage flexibility in our current resources that are already in the hands of current grantees to help them cover emergency costs during the COVID outbreak. But we can also apply additional resources to individuals that may be going without resources at this time. And fortunately, we regret that not fortunate, but we regret recognition of the disproportionate burden that we're seeing across the country of COVID on Black and Brown communities, particularly. in the Southeast, in the Midwest, and in the Global South. The experiences of incarceration and mistreatment by local authorities has been sad to see, but this only underscores why we need to remain committed to our strategy and maintain our focus on the work that we're doing to address stigma, to address structural barriers and inequality among people living with HIV, and make sure that everybody maintains or increases access to HIV prevention care and treatment during this time. EGF will continue to monitor developments surrounding the COVID-19 pandemic and will determine how we will adjust in a post-COVID-19 world. Our commitment remains strong to ending the AIDS epidemic in the United States and around the world. COVID-19 will not waver us from that mission. We will continue to support efforts that strengthen how communities and public health work together to respond to HIV as well as co-occurring COVID-19 where necessary. And we also want to learn from you about what you're seeing and what you're experiencing on the ground. So you all have my email address. I hope that anyone who's doing any kind of monitoring or surveying of any of the results that are occurring as a result of the COVID-19, particularly on people that are at increased risk or are living with HIV, we hope you will share those results with us because we'll be happy to make use of that data in planning for our future grant making. Thank you for your time. And now I'd like to turn it over to Darwin Thompson to talk a little bit about what Gilead is doing in light of the crisis.
Thank you, Kali. With these webinars, I was on mute. Thank you, Paul and John, for having us, and thank you, Kali, again for your presentation. Darwin Thompson, I'm the Associate Director of Public Affairs with Gilead Sciences. It's so good to have heard a number of friends already on the call, and hopefully additional friends listening. So just wanted to give you guys a brief update on what Gilead Sciences is doing to address COVID-19 with our current grantees. And can everyone see my screen?
Yes, we can see your screen. Thank you.
Perfect. So I wanted to just give a brief background on Gilead's commitment to COVID-19, but also just our commitment to HIV in general. At Gilead Sciences, we take a more than medicine approach to addressing health challenges that communities face, specifically communities of color and those disproportionately affected by HIV. And so on a year-to-year basis, we provide nearly $400 billion globally to support nonprofits working on the front lines for HIV and other diseases that we make medications for. Specifically with the COVID-19 pandemic, Gilead has committed or initiated the following. We have several phase 3 studies working to evaluate the safety and efficacy of remdesivir. And I just want to note that remdesivir is an investigational agent and is not approved anywhere for treatment with COVID-19 currently. We also have worked with our manufacturers to accelerate and expand the available drug supply of remdesivir at a rapid rate, and decreasing the production time from 12 months to 6 months. In addition, we will donate our current supply of remdesivir at no cost to treat patients if the drug is approved for symptoms of COVID-19. That is approximately 1.5 million doses that are currently available for compassionate use. As well as we have decided to develop a $20 million philanthropic fund to support nonprofit organizations impacted by the COVID-19 crisis, which is our Gilead Cares Emergency Relief Fund. So I want to talk about what we're currently doing for programmatic grants and sponsorships prior to talking about our Gilead Cares Emergency Relief Fund. So similar to what the Elton John AIDS Foundation did, Gilead immediately sent out a note to all of our grantees reconfirming our commitment to them in this crisis. Really wanted to let them know that we stand with them and we stand with community. In doing so, we surveyed a number of grantees to assess what their needs were in this time, how we could better support them currently and in the future, and worked at an expedited pace to develop a response for current grantees. And some of the things that we're doing with our current grantees are allowing organizations to repurpose certain grant funds, including sponsorships or canceled events. We wanted to immediately commit to grantees that we would not ask for sponsorship dollars back, but we would allow them to utilize those funds to support general operating needs. We also then allowed them to reallocate programmatic grant funds to support urgent operating needs such as PPE equipment, purchasing technology, or also HIPAA compliant software for telework. Several projects and events would be delayed because of COVID-19, so we immediately offered no-cost extensions to grantees so that they could really focus on the day-to-day work that they were doing with the clients that they serve. And then lastly, providing programmatic and budget reconciliation extensions for reports that are due, because we understand the need for flexibility within the work that we're doing and not having to sit and submit reports. So we are allowing grantees flexibility within submitting reporting that are currently due to Gilead or will be due in the future. So I want to also talk briefly about our Gilead Cares COVID-19 emergency fund. So what we are committing is $20 million globally to support currently funded organizations across all of our therapeutic areas. In order to be eligible for funding under the Gilead Cares program, you have to have received grant funding since 2018, January 1st, 2018, and organizations are eligible to receive up to $100,000 to support, but not limited to, some of the following activities listed below. General operating support to sustain critical operations, retention of furloughed employees, costs associated with implementing remote working arrangements or other social distancing measures, and then unrecoverable expenses related to canceled events and other related activities. While this list isn't exhaustive, if you have specific questions related to activities or supported activities under the Gilead Cares program, please feel free to email your grants manager or grants@gilead.com. I'm also aware that MAC will be publishing my email address, so if there are specific questions that I can answer immediately, please feel free to email me. So I just want to also talk about other things that we're doing, not from a specific grantee perspective, but just as a Gilead commitment to COVID-19. We wanted to ensure where we have our headquarters both at our Kite subsidiary as well as our Foster City location, that we were supporting our local community. So with that, we've made a $1 million commitment to the San Mateo County Strong Fund, where our Gilead headquarters are located, as well as a $1 million donation to the Mayor's Fund for Los Angeles, where our Kite location is headquartered. And then we have also implemented an employee matching program, where Gilead will be providing matching donations to the following global relief organizations: the Direct Relief, the UN Foundation's COVID-19 Solidarity Response Fund, and the International Medical Corps. So with that, I think I will turn it over to Paul, and I'm happy to answer any questions around our response to COVID-19 or our Gilead Cares Emergency Relief Fund. Paul, thank you for having us, and I look forward to your questions.
Thank you. Okay, so folks, this is time for questions. Darren, if we could get rid of your PowerPoint presentation, great. And Kali, if we could really light up your screen, that'd be wonderful. And now for the people who are in the audience, if you would like to ask questions, just put it in the question box and with your name, and Chip will start going through them and asking them to us. So Chip, do we have any questions?
We have a first one, and this is a question for Kali. Are EJAF funds available for those of us that are not currently partners?
Unfortunately not. As much as we would like to put those resources out and make them available wider, for two reasons. One of the reasons is because we want to get those emergency resources as quickly as possible. So we wanted to limit the individuals that were able, so we could be able to respond to the number of applications we got in a reasonable amount of time. But what we will do is actually put those that call to for proposals back out again, probably within the next couple of weeks, depending on resource availability. And if possible, we will try to open that up to more people if we can.
Great. Chip, next question.
Okay. Next question from Julia. Do you have any recommendations for ETE or EHE projects that are seeking operational funding support during this time?
I'm sorry, could you say that question again?
Sure. Do you have any recommendations for ETE or EHE projects that are seeking operational funding support during this time?
Well, I would, for your EHE, for your ending the epidemic work, we had Harold Phillips on last week, and when Harold talked about it, he said that while programs are going to be continuing and moving forward, the reality is that we're still having to figure out how to provide services in this new environment. And so in terms of EHE efforts, my suggestion to you is that you work with your local health department to figure out about infrastructure dollars. However, John, maybe you have some thoughts about other places people could find infrastructure support for their ending the HIV epidemic efforts.
As I mentioned earlier, I think that one place that everybody should check is their local community foundation. Especially if you're working on ending the epidemic work, it's most likely in your own community. And a lot of community foundations, I know New York Community Trust and many others have started COVID relief funds. There are also some resources listed on our webpage. We'll be updating those regularly as we hear about new opportunities.
Next question, Chip.
Sure, this is from Jillian. For the Gilead grant eligibility, does that include organizations funded under Compass through a coordinating center?
That's a really good question. So currently, grantees have to be directly funded through Gilead corporate grants to receive funds under Gilead Cares. However, we are making additional resources available to our coordinating centers, both under our Compass initiative as well as Help Connect and our Transcend initiative for their sub-grantees for emergency support. So if you have additional questions, you should reach out to your coordinating center for more details on how to apply for resources.
Thank you. Next question, Chip.
So this is from Rosa. Is there somewhere we can find a list of your partners? And I don't know who she was directing that to, but that is the question.
So I don't quite understand that question, but if you're asking for a list of existing grantees for the Elton John AIDS Foundation and or Gilead, my recommendation would be to contact them directly and see what kind of information they release on their grantees. Next question.
And if you're talking about FCAA member organizations, they're listed on our website.
Oh, good. And John,
the same is true for each of them. Sorry, Kawal.
No, John, how many members do you have? Oh, we lost you, John. Okay, next question, please. In other words,
Darwin,
yes, go ahead, Chip.
So this is for Darwin. It says the eligibility for Gilead Cares funds, is that specifically grants or also sponsorships?
Another great question. It's currently only open for organizations who received a corporate grant, not a sponsorship. We're always reassessing our relief fund, and we may open it up for sponsorships in the near future, but it's currently only open for grantees.
Next question, Chip.
Okay, another question for Darwin. Will Gilead open funding to organizations that are not currently funded?
Yes, so if you are interested in grant funding, not through Gilead Cares, but through Gilead in general, our grant process is rolling. You can submit an application through our online grants portal. or email me directly, and I'm happy to talk about specific organizational priorities and how we could potentially support. One of our commitments is that Gilead is not stopping our grant making to organizations. This is a specific pot of money to support our currently funded organizations. And so we are always looking for new innovative projects to support. So I'm happy to have conversations around organizational priorities to see if there's some synergy with us and your organization.
Thank you. Next question, Chip.
Is the $100,000 Gilead Care support predicated on an organization having a low level of financial reserves?
I feel like I'm on a hot seat. So there's 5 questions. We do ask what is your current financial reserves and the current impact that COVID-19 has on your organization. We take that into consideration. It is also about organizational need at this current time. So we're trying to be as flexible as possible with organizations with small amounts of reserves, as well as organizations with large amounts of reserves, to put the right amount of money to those organizations where possible.
Right. And you know, and Darwin, don't take it personally, but it's a lot of money, so people have a lot of questions for you. So thank you for being here. We really, really do appreciate it. And Carly, don't take it personally, because we also really appreciate Elton John being here, and we really thank you both for being here. And I just wanted to point out that if you haven't noticed, we have 2 gay men of color running these initiatives, and I just think that's a really cool thing. But Chip, next question.
Sure. Has anyone considered making a bulk purchase of protective supplies provided their existing grantees? And if so, what supplier did you all use?
Did any of you buy PPE?
So at Gilead, if you email me, I can connect you to my coworker who is taking inquiries around PPE equipment, and we are donating PPE equipment. So feel free to contact me, and I can connect you with the right person.
Wow. Could you explain that program a little bit more? I didn't know this.
So we typically donate supplies, and so we've received a number of requests for PPE equipment, and so if we have excess, we have been donating it to communities. And so I'm not sure how much we have left over, but I'm happy to connect. I'm happy to be a connector and connect to the right person and see if there's an opportunity for donation. Thank
you. Chip, next question.
This next one's for Kali, and it's a bit of a long one, so please bear with me. Thanks so much for the presentation and for EJAF's generous support opportunities in these trying times. In reading through the opportunity, it seems more geared toward direct services organizations. Is there a role for grant-making advocacy organizations that are trying to address structural barriers and inequalities to ensure access to treatment, prevention, testing to end the HIV epidemic?
That is a really great question. I'm going to have to answer it in 2 ways. The first answer is, if your work is overall focused on addressing structural inequities and barriers for individuals living with or who are vulnerable to HIV, then you are very much eligible to apply for EJAF support through our traditional grantee or through our traditional grant-making application process. Our resources, specifically through our emergency support fund, are only for service delivery or efforts to make service delivery to people living with and at risk for HIV easier. So it would not include advocacy unless the advocacy was specifically about addressing a specific barrier that was around providing access during the emergency crisis. So if you feel that you can make the case about how there is some administrative barrier or legal barrier that you need to take action on immediately, certainly you can apply to the support fund for that. But if it's broader, please use our traditional application process.
Great. Chip, next question, please.
Next question is from Alvin Quamina. I'm sorry if I'm butchering names here, from NAESM in Atlanta. Is there a clearinghouse that any of you are aware of where all possible sources of COVID-related funding support can be found?
John, I think that's a good question for you.
We're doing the best that we can on our website to share HIV-specific funders, but also links to broader philanthropy groups such as the Council on Foundations, the United Philanthropy Forum, and Candid, and other resources. So I would say check our website and check the links to other organizations through our website. And if you have further questions, shoot me an email and I'll be happy to help direct you.
John, can you give the URL for your website?
Sure, it's www.fcaids.org.
Great. And maybe Chip, if you could put that up on the chat section so everyone can see that, I think people might appreciate it. So next question.
Sure, it's a question for Darwin. Does Gilead have plans to expand PrEP copay programs for people who may have lost their insurance?
I think there's a does.
So I'm actually not the proper person to answer that fully. I can tell you that we have expanded our Advancing Access program during COVID-19 to do overrides so individuals can get up to a 90-day supply. But if you email me that question, I can connect you to the right person for that answer.
Great, thank you. Next question, please.
Again for Darwin. With so many people becoming unemployed and losing health insurance, can drug companies expand patient assistance programs? I think that's a similar question, but expand patient assistance programs with financial eligibility criteria and length of eligibility so people don't interrupt ARV treatment.
Again, that's a great question. I'm not the proper person to answer that question, but I'm an amazing connector and could connect you to the right person.
So what I want to say to everyone who's on the call is, and I'm sure that none of you are missing this, but as the pushiest queen in the room, they're saying call me and email me. So please make sure to take that opportunity to call and email everybody here, because these are my resources. These are the people that I turn to when I need help. And so I'm thankful to them for being able to offer their assistance during this difficult times. Next question.
This is a question from Wakefield. Are funders asking that we distinguish between funds that are designated for sustaining our organization and funds that are to meet service needs resulting from changes in client needs due to job loss or increased healthcare needs?
John, I think that's a question for you.
I'm sorry, could you repeat the question?
Sure. Are funders asking that we distinguish between funds that are designated for sustaining our organization and funds that are to meet service needs resulting from changes in a client needs due to job loss or increased healthcare needs?
I think it varies by funder. I think each funder has their own perspective, but I would say in general, what we've seen is a lot of flexibility and most funders just offering general operating support.
Thank you, John. Chip, next question.
Will FCAA host a call with funders who may be interested in funding HIV organizations in the future?
Sure, we can do that.
And can we be on it is the more important question, John. So good, yeah. Let's go on. The next one question.
I think it's a great idea.
You suggested expanding funding prospects. Any suggestions about opportunity areas?
So let me answer that one, because I think that one is a very difficult one that we're all trying to figure out right now. And I think that's the biggest challenge, is that to the extent that we all find ourselves in this impossible position, so does the rest of the world. And that's what makes this so difficult, is that every nonprofit is going through what we're going through. All the diseases are going through what we're going through. All of the social services are going through what we're going through. And so the challenge is, how do funders make kind of almost impossible decisions between all of the need that is going to be out there? Part of why NMEC has been pushing so hard to the HIV specific funders is because we are very concerned that given all of the need that is going to be out there, that HIV organizations will not necessarily receive the funding that they need to get through these difficult times. And so while we strongly encourage you to look for resources from your local United Way, to look for resources from local corporations and foundations, as well as individual donors. I think it's just important to understand that everyone is being inundated with an ask right now. I think it's particularly difficult for individual donors and for those organizations that rely on individual donors, because not only are the individual donors getting more requests, but often if they were wealthy individuals, their portfolios have probably taken a fairly substantial hit over the last 45 days. And as a result, I have frequently heard from donors that they're on a pause right now to see where this all falls out, including their money. And I guess what I would say to all of you is that, unfortunately, that doesn't work for us, that we need answers now. And so while I would strongly encourage you to reach out to new people, start at your existing donors, because I think they're probably going to be the most likely to get you through this time period. Next question, Chip.
Sure. Are there funds to develop new direct services for persons and families impacted by COVID-19 who may not be impacted by HIV?
No, I don't know that one. John?
I mean, there are a lot of COVID relief funds that are, targeted generally. I just saw that Ford Foundation partnered with a number of other foundations. There's information on their website. I think if you go to Council on Foundations website, there are links to other kind of general relief funds targeting COVID.
So John, some of these folks may not know the Council on Foundations. Can you briefly say who they are so that people on the call can be aware?
Sure. So Council on Foundations is a membership association, a broad membership association of corporate funders and foundation funders, community foundations, family foundations, organizations like FCAA, Grantmakers in Health, others like that are topic specific. But Council on Foundations is more of like a trade association for funders. They lobby on Capitol Hill. They focus more broadly on philanthropic issues, and their members are, it's a very large network of funders, much broader than any of the affinity groups like Funders Concerned About AIDS.
Do you know their website address?
It is cof.org.
cof.org. That's easy. Great. Thank you. Next question, Chip.
Question for Darwin. Will Gilead Cares cover increased need for policy changes, i.e. access for drug users with HIV, accessing services in a COVID climate?
So our COVID Cares fund is really for organizational sustainability. And so I think it's an individual organization, case-by-case basis around how they want to utilize up to $100,000 to support clients or to support, keeping the doors of the organization open. So I'm happy to have that conversation individually, because it does seem very individualized, to see what's the best route for applying for funding.
I guess the thing that I would say in response to it is that in my discussions with most of the donors, they're being fairly flexible. And so I would suggest that as you are looking at putting together requests to anyone, that you look at where your real need is, and that you speak to what your real need is, and that most people will understand during this time period, it's not about what they want, but it's about what's needed. And for most of us, it is about keeping the doors open. And I think that people understand that that means infrastructure grants right now. That means helping people to do what it's going to take to keep their doors open. And so I would not be afraid of asking for that type of funding during this difficult time. Next question, please.
Since Durex is closed down, what is being done to reassure condoms will be made available if agencies have to order from other resources?
Wow, I didn't know that. Did anybody know this?
didn't.
Yeah, I'm sorry. I did not know this, but I will take some time to look into it. So Durex has shut down and they're not producing condoms anymore. If anyone has any information, please, please let us know. I was completely unaware of that, and that is very problematic. Next question, please.
For Darwin, working in rural areas has been more than overwhelming. Additional services are needed to provide holistic services, including innovative COVID-19 education intervention. May the grant funds be used to provide these services?
So unfortunately, COVID-19 is not a therapeutic area for Gilead, so we really want to stay within our therapeutic areas. And so we're really just providing resources for HIV and hepatitis C organizations to be sustainable. So we're not expanding to COVID-19 education just yet, maybe in the future, but currently we are sticking with our therapeutic areas right now.
Thank you. Next question, Chip.
Well, this is this is not a serious question. It says, how did Paul get a fresh haircut?
Yeah, this is how I get my haircut, just so that you all may want to see, and it's really quite fun. What I do is I turn to Mr. Potato Head, and Mr. Potato Head always tells me how I look better or not. And sometimes you just have to laugh during all of this, folks, because it's really difficult times. And I really appreciate everyone who is working so hard. You know, I don't know about you, but I have had some very real cabin fever and have learned that if I don't figure out how to smile and laugh during all of this. And so my other smile and laugh statement is, I want you to know how gay am I. So how gay are you, Paul Kawada? This is how gay I am. I'd like you to look at the wallpaper in my apartment. It has crowns. That's how gay I am. I am so gay that my wallpaper has crowns in it. And what I want you to know is it looks like Barbie's dream house in my apartment, or actually someone told me it looks like Barbie's dream house on acid. And I would probably agree with that. And so thank you for making me laugh. Let's go to the next question.
Sure. Is there funding available for innovative HIV testing programs like in-home or HIV self-testing to reach those who need testing?
So a couple of pieces on that one that I think are important. We've been talking with CDC and HRSA. As you noticed, or may have noticed, HRSA, specifically the Ryan White Care Act, got money to distribute immediately for COVID-19 relief for HIV organizations through the Ryan White Care Act. We understand that CDC is also getting some of the stimulus money, although it hasn't been targeted specifically for HIV. In a future webinar, we will be inviting Dr. Cheever and Dr. Merman to come and talk with all of you about some of their issues. I also know that Dr. Cheever is doing a go-to meeting tomorrow with FAP. And so if you are available and on the FAP listserv, I would strongly encourage you to be a part of that go-to meeting. Next question, please. No more questions, Chip? Well, I have a couple questions that I would like to ask each of the donors and John, who are here as we kind of go through this next phase. As nonprofits are looking to figure out how to get through this time period, what are your recommendations for them on how to survive? John, let's start with you.
Thanks for starting with me. I think that you had some good advice about going to the donors who have supported you all along. I think, as you've seen with Gilead and Elton John AIDS Foundation on this call, donors are focusing on their current partners. So go to your donors. who are working with you now. Also, as I mentioned before, try to think outside of the HIV silo. There are fewer and fewer HIV donors, and the work that you do is broader than HIV. It's about health access, it's about human rights, it's about reproductive justice, it's about LGBT communities and communities of color and immigration, and there are funders who focus on all of these who don't think about HIV, but will connect with you based on the intersections that you're working in. So I guess that would be my advice.
John, is there a good resource page for people to look at that kind of breaks down funders and the topic areas that they support?
Well, a lot of, almost all of the affinity groups belong to an organization called United Philanthropy Forum. And I'm not remembering their, I think it's United Phil Forum, PHIL forum.org. But if you Google United Philanthropy Forum, that will take you to their page, and that will list all of the different affinity groups. There's sustainable development, there's all sorts of funder affinity groups. And in addition to that, there are regional funder affinity groups. So wherever you live in the country, there is a regional funder affinity group who are local funders in your area. And that list of regional affinity groups is also in United Philanthropy Forum. So I would definitely check those out, because I think a lot of funders are focusing on their own communities. Again, like you heard Darwin say, funders want to fund where they live and work. So check out United Philanthropy Forum for more ideas.
Darwin or Kali, anything you'd like to add to that about recommendations for organizations on what's the best survival strategy during these difficult times?
Yeah, I mean, I think that, we want to reiterate that we stand with community at Gilead. I do think, though, and this is IMO in my own opinion, I do think that while these are scary times, I do think it really gives organizations an opportunity to reevaluate how we do work and how we do work moving forward. So I think there are opportunities around more remote work, telehealth, and trying to figure out are those the right strategies to make sure that organizations are nimble moving forward. Because I do think this is a really good opportunity. I joke with my coworkers, this is a really good opportunity for us to strategically plan, because post-COVID, we need to hit the ground running, and the way that we do work is going to be uniquely different. So I do think while in order to survive or in order to stay, quote unquote sane, it's a really good opportunity to start strategically planning for the future and figuring out what resources are needed to kind of move the needle forward. But the other thing I think I would reiterate is, I think these are opportunities now to ask. You don't ask your donors, ask your individual donors and your funders, if you need help, because I think that the more and more that people know that you need help, the more and more I think people will be willing to donate where possible. So I think those are kind of two strategies that I would say for moving forward.
Yeah, and I'd only hit three things really quickly, and I'm piggybacking off of what Darwin just said. I will only add a friendly amendment to that to say, leverage that idea that just came through about self-testing and talk about how that would make a difference in the HIV work moving forward. We'll be very interested to hear how some of the lessons learned from the COVID emergency have resulted in some innovation and ingenuity in the HIV response locally and nationally as a result of this crisis. I'd also make sure that you're checking on your staff and all the people that work with you and around you. I think if you can do video conference calls, or you can do happy hours, whatever you can do to maintain the morale and just check in on people, I think that gives you an opportunity to reintroduce yourself during this time in a very thoughtful and compassionate way to many of the people that you work with, and it'll create a different relationship, hopefully, with you following and post this crisis. And the only final thing that I would say is that, it's probably a really good time for us to really kind of dig deep and think about how we can really kind of adjust our ongoing efforts in the fight against HIV. So if we can become more virtual and put more money into our reserves, the emergency support fund is coming out of our reserve resources. So if there's any way possible that we can identify flexible resources to contribute to a reserve, that's probably the lesson of the moment.
So I am going to step in because we're about to close, and I want to thank all of our speakers for being here with us today. These are extraordinarily difficult times, and none of us knows when we're going back to work, how we're going back to work, what is the world going to be like when we return. And we are being challenged at a level that I don't think we've ever been challenged for before. And what I would ask all of you to do is keep the faith. We will get back to normal at some point. I'm not sure when that point is, but we will get back to normal. I watch Dr. Fauci every evening on the briefings, and I feel extraordinarily comforted by his words. Dr. Fauci is someone who I've known for many, many, many years, and someone who I know understands infectious diseases and because of his experience with HIV. I want to thank all of you for working so hard. This is not expected, this was not anticipated, but that we will continue to work and fight because we still have an epidemic to end after COVID-19. We still have some very important work to do and achieve after we get through this phase. And so thank you all for everything that you're doing. Thank you for joining today's call, and hopefully we will see you all next week. Have a good evening. Bye-bye. Thanks, Chip.
Bye.
Thanks, Paul.
Thanks.